Okay, I think we're ready to roll. Hello and welcome. We're live with policybazaar.ae today to talk about World Ovarian Cancer Day and the importance of raising awareness. This is Bhairavi Prakash, and today we're shining light on an often overlooked topic, even though it is cancer. Um, and the topic today is ovarian cancer. Joining me is a distinguished expert, Dr. Shaheenah, a leading oncologist from Mediclinic. Dr. Shaheenah, it's a pleasure to have you here.
Thank you so much, Vervi. It's an honor being on this platform, and I'm so glad that you guys have put together this topic today because we have so much media out there that discusses ovarian cancer, colon cancer, but we don't really address the topic of ovarian cancer, and we know
True.
that it's a very subtle disease, a silent killer. So
Yeah.
I like platforms like this that allow us to engage and educate people out there.
Yeah. And of course, in a very conversational manner. So, in this session, we're going to be discussing warning signs, risk factors, the role of genetic testing, and of course, because it's with policybazaar.ae, so we're going to talk about how insurance coverage can support patients through treatment, monetarily, and mentally, of course. So, we're also going to be taking your live questions. Please drop them in the chat if you've got any question whatsoever, because as my father always says, there's no dumb questions. So send us your questions and we'll have Dr. Shaheenah that would answer them as well. So let's begin with the basics, Dr. Shaheenah. Why is ovarian cancer such a critical issue for women's health today?
It's critical because of a number of different factors. One, there isn't as much awareness about this type of malignancy compared to other types of malignancy. So we need to now start making people aware. And the
Yeah.
fact of the matter is, a lot of women come and present late with ovarian cancer. The real reason being that there is the signs and symptoms associated with ovarian cancer are very subtle, like I mentioned before, and is often missed by not only the patient, but also by physicians. Because when patients come in, they've got symptoms and signs that could be anything. It could be a gastroenteritis, it could be just a simple abdominal pain. But unfortunately, as physicians, we need to be more aware, but we're not as aware. So I'm hoping that awareness will not be only for patients, but
Yeah.
also for physicians to be, alert that a woman, especially a woman with a strong family history, should be looked at in terms of possibly having ovarian cancer.
Right. And again, this live session is not just for women because everyone, we're either from, we're all coming from a woman, but we're all surrounded with women as well. So it could be anyone you're related to, friends with. Share with me, what are the early symptoms? How does someone spot the early symptoms of ovarian cancer?
So unlike breast cancer, unlike colon cancer, ovarian cancer is not very specific in its symptoms, but inability to eat, having abdominal bloating after eating, pelvic pain, finding that your abdomen is getting distended and the growth is increasing in size. These are some of the symptoms that one could think about as being early signs of ovarian cancer.
And are there any specific risk factors or groups of women who perhaps are more vulnerable to ovarian cancer?
So, women who are taking hormone replacement therapy are at a slightly higher risk. Those whose body weights are above that of the average weight they're also at a slightly higher risk. Women who do not have children, who have not breastfed, are also at a slightly higher risk. And of course, a strong family history. If there is a gene running in the family like
Yeah.
BRCA1, BRCA2, RAD51 or BRIP or PALB2. These are some of the genes that are associated with a higher risk of developing ovarian cancer. Um, Having some genetic syndromes in the family, such as syndrome, is also puts women at a higher risk of developing ovarian cancer.
What are the treatment options like for ovarian cancer? And yeah, take us through all the treatment options.
So, if you'd asked me this question 20 years ago, and yes, I am that old, when I was in training, this answer would have been really, really simple. One line answer, and that's it. Everybody gets chemotherapy, and that's the way we treat ovarian cancer. But now in 2025, there's been an explosion of data, an explosion of our understanding of how to treat women who've got ovarian cancer. And really, the first thing that we need to understand is that not every woman's ovarian cancer is the same. There's not one type of ovarian cancer, there are multiple types of ovarian cancer. So, the first thing that you need to discern is what type of ovarian cancer you have. The second thing is that when you're entering a treatment program, it's important that your treatment is within a multidisciplinary unit where you're not only being treated by a medical oncologist, you're being treated by a surgeon, good pathologist, radiation oncologist. So it's important to have that multidisciplinary team that will devise a therapeutic plan that is specific for that particular patient. Once you have identified the type of ovarian cancer and you've developed that plan, the typical road journey or that pathway that a patient usually goes through
Yeah.
is surgery, chemotherapy if they require it. And not everybody actually requires chemotherapy. And like I said, there's not just one type of ovarian cancer now. More times, more often than not, we actually profile these tumors to understand the genetic makeup and the genomic biological makeup of that tumor so that targeted therapy can start to be introduced. In the last decade, we've even started introducing immunotherapy within
Yeah.
the realm of treating patients with ovarian cancer. So it's not as simple as this is the way I'm going to treat it. Everyone has an individualized therapeutic plan that gives you the best prognostic outcome ultimately.
Yeah, well, you said 20 years back, and I was about to say, I'm a very filmy person, so I was just going to say, आपकी त्वचा से आपकी उम्र का तकाजा नहीं हो सकता. But swiftly moving on to, whenever we talk about cancer, we obviously talk about tests, right? And getting monitored. I'm assuming, is it the same with when it comes to ovarian health? Can it be monitored as well through these regular tests or ultrasounds?
So, unfortunately, compared to cancers that we typically tend to screen, like lung cancer, cervix cancer, breast, colon cancer, where there's certain tests that you do that allow you for
Yeah.
screening, ovarian cancer is not that easy to screen. In fact, there is no standard screening program for ovarian cancer. Having said that, if you, and I always say this, every human being, I'm not only talking about women now, every adult, every child should have a general practitioner who's going to be doing their regular checkups every year. So important. And that general practitioner should know the history of the family and to see if that woman is at a higher risk of developing ovarian cancer. Once you've gotten that information and you know that this particular person is at a higher risk, then you start trying to do a few tests that could potentially allow you to pick up things early. It's not a proper screening program, but having your labs done regularly, having ultrasounds, especially of the pelvis, done regularly, educating the woman that if you feel pelvic pain or abdominal growth, over a short period of time, come early so that we can investigate. Unfortunately, I can't say that there is a screening program, but these are some of the early things that one can do to try and detect things as early as possible. Now, if someone has a strong, strong family history, and you are suspecting that there is a genetic problem running in the family, like BRCA, such as BRCA1 and BRCA2, instigate that test. Allow that woman to be counseled and then do the test. And if that woman does find out that she has a BRCA1 or BRCA2 mutation, then at a certain age, and that, for example, BRCA1 after the age of 40 and for BRCA2 after the age of 50, your risk of ovarian cancer exponentially rises. And at that point, it's important not only to counsel the patient, but to send that lady to a gynae oncologist to discuss about potentially removing the ovaries, because that's the best thing that you can do to
Right.
reduce your risk of ovarian cancer.
So, what does ovarian cancer mean for women who are hoping to become mothers? Because I remember initially, as we started this live session, you did mention about the fact that women who haven't become mothers or who haven't breastfed are at a higher risk. Is that right?
Yes, yes. Not having children and not having breastfed puts you at a slightly higher risk. It's not a phenomenally high risk, but it is what
Okay.
thought to be one of those risk factors.
So, but
But yeah, go
in
ahead.
that case, how do you-
No, no, go ahead.
yeah. So then, what does ovarian cancer mean for women who are hoping to become mothers?
Well, if you're wanting to be a mom, you have to do it at the right age, obviously. But if you have a high risk family history and you've tested yourself and you are known to have a BRCA1 or a BRCA2 mutation, have your children as early as possible would be my advice. And number two, if you don't want to have your children as early as possible, it's important to harvest your eggs and bank them because ovarian cancer unfortunately can strike at any time, although that incidence is higher the older you get. Um, so it's just doing those things, knowing your family history and planning your family as early as possible.
Yeah. I think this has been so insightful so far. And again, for all the viewers watching this, if you've got any question for Dr. Shahina, just message it, comment right now, and touch on the emotional journey. Any cancer is, of course, exhausting for the patient, for the people, the patient's family, friends. Now, how does an ovarian cancer diagnosis impact a patient mentally, emotionally?
So I always say that that journey that someone goes through with cancer is divided into several parts. You have that journey when you're initially diagnosed, where is the shock of even knowing that something like cancer can strike you.
Right?
And usually we make the patient focus on the fact that yes, it's happened, but we need to focus on getting you treated because we're
Yeah.
trying to cure you. Ultimately, that's the goal. But we shouldn't lose sight, all physicians shouldn't lose sight of the fact that this woman is going to lose her ovaries. And if she's young, it's going to have potential impact on her lifestyle, on her being a woman at the end of the day,
Yeah.
right? Because you're changing the hormones in this woman. You're removing her ovaries. You're sending her into premature menopause if she's young. So we have to recognize that and we have to
Yeah.
deal with it. But it's not only the patient. It's not only dealing with the emotions of the patient. It's the family members around the patient that we also have to acknowledge because they're going through this journey with the patient. So we need to understand that. We have to acknowledge, we have to counsel our patients very, very well. And we have to take them through that journey of the treatment, which includes the surgery, it includes the chemotherapy. But the real journey actually starts after that, after the treatment. Because now you have to live with the fact that you had cancer. That's number one. You have to live with the fact that the cancer could potentially come back at a time point, and that can really play on someone's mind. And you have to live with the fact that you're no longer the same. As a woman, you're no longer the same. Your
Yeah.
hormones are being taken away from you. You can't be put on hormone replacement therapy as many women can use.
Yeah.
They don't have ovarian cancer. And so your body doesn't feel the same. Mentally, you're not the same. And asking for that help to go through that journey is wise. That's where the psychologist comes in. That's
Right.
where family members come in. And the family members have to be counseled to be as supportive as possible. I always tell my patients it's important to go back into their normal lifestyles as much as possible after they've gone through that journey of the treatment. But it's easy for me to say, it's difficult for a woman to actually do. And that's why you need all the help that you can get. Exercise is important. Trying to get yoga, and yoga is, I've actually found yoga to be very, very helpful in patients
Yeah.
who are going through the treatment journey and post that. Acupuncture can help, and acupuncture helps not only with the symptoms of the treatment that you get, such as the chemotherapy, but it also helps to reduce the symptoms of menopause, of helping with the hot flashes, with the mood swings, trying to regain your energy back. That is also so important because if you're feeling fatigued all the time, you're
Yeah.
not going to be able to get back into your normal groove of things. So you need to recognize which are the symptoms that you need to address and address it with your physician. It's not only the oncologist, it's your GP that can also take you through that journey. It's your husband, it's your mom, it's your sister, it's your brother, it's your psychologist. Everyone is there to help you get through
Yes.
that journey ultimately. You're not
And
doing it alone.
they often say that, right? You, like cancer is not just beaten by the patient, but it's a whole unit's effort. It's, well, of course, the
Exactly.
doctors, but the family, friends, everyone's got to
Exactly.
support. Yeah. Okay, now so many audience questions have come through. Doctor, you ready?
I'm ready.
Of course you are. Okay, let's start with this one. When is the right time to get tested, or should people do regular testing?
I said that right at the very beginning. I
Yeah.
want at the end of this session, if I've given any take home message today, go and get yourself a GP or a family medicine doctor and get yourself checked out and be on a regular checkup program, not only for adults, but for children as well.
Okay. When is the right time to? Okay, this one's in the same. Oh, yeah. Can a family history of breast or ovarian cancer increase your risk? That's a good one.
Absolutely, yes.
Yeah.
That's that your a family history of ovarian cancer, family history of breast cancer are important pieces of information that you need to give your GP. For example, breast cancer, if you have a member in your family, for example, your mother had breast cancer at say the age of 40, you
Yeah.
need to start doing your tests 10 years earlier. Similarly, if you've got first degree relatives who've got ovarian cancer, you need to tell your GP and they will make sure that you're being screened appropriately. Now, remember, screening for ovarian, not the same as like that for breast, but at least tests like pelvic ultrasounds, tumor markers, physical examination, getting your gynae to check you out is also important.
All right. What age should one ideally get tested at?
So there's no specific age. I wish there were. For breast cancer, I would give you specific ages,
Yeah.
but not for ovarian cancer. It really depends on your family history. And like I said, you start a decade earlier for whatever family history you have in terms of the ages of people who've had ovarian cancer. But like I said, if you go to your GP and you have regular checkups and you tell your GP your signs and symptoms, they will immediately instigate those tests.
Yeah.
So for ovarian cancer, there's no specific age, but the one exception, of course, is if you have that genetic mutation in the family, like BRCA1 or BRCA2, or you
Yeah.
have genetic syndrome in the family, like Lynch. Again, your GP will start your tests much, much earlier, again, 10 to 15 years earlier than the
Yeah.
youngest age of the family member that had the malignancy.
Okay. Um, what lifestyle changes can help reduce the risk of ovarian cancer? I was gonna ask you. I'm like, for all we know, the age right now, you're not able to give us an age because it's happening to so many people, right? Which is why we're doing this live
Yes.
session. So yeah, do you blame lifestyle changes for
I mean, we
the?
can sit and blame a lot of different things here. And I invite you, Bhairavi, one day to come and sit in my office. You will find that it has no health consciousness there. There's chocolates, there's sweets, there's teddy bears everywhere. And I always say that don't put things into your diet, don't remove things from your diet. You need to have a healthy, balanced diet. That is
Mm,
first thing and foremost that one should do. Second, exercise is very, very important. 30 minutes minimum of walking every day. If you can do more, very good. But if you're not someone that likes to exercise, at least 30 minutes of walking every day. And then very important, and I said this very in the very beginning of this live show today,
yeah,
that being obese or having a higher body weight puts you at a slightly higher risk of getting ovarian cancer. So try to be at your ideal body weight. That is very, very important. And of course, it's always good to have a healthy lifestyle,
of course.
not
Yeah,
only for ovarian cancer, but for life in general, because it's
right.
not only about cancer, and that too, not only about ovarian cancer, it's about keeping your blood pressure right, keeping your sugar levels right, keeping
Yes.
yourself from having a heart attack at the end of the day. So it's not isolated ovarian cancer. A healthy lifestyle is important for everyone at the end of the day.
Yeah, true. Well, this one's a good one. Can you have kids after ovarian cancer, or is it not possible at all?
So, difficult question to answer because it
Yeah.
really depends on the type of ovarian cancer that someone has. The most common, these are the three types of ovarian cancer. You have epithelial ovarian cancers, you have germ cell tumors, and then you've got sex cord tumors. And it really depends what type. The most common type is epithelial ovarian cancers, and the most common type of that is high grade serous carcinomas. And if someone has that, unfortunately, you can't have children after that because the fundamental treatment is to remove the ovaries and remove the uterus at that point and have a good surgery followed by chemotherapy. But if you have say a rarer type of ovarian cancer, like a borderline tumor or um, a small sex cord tumor or something that is very rare and very early stage, there
Right.
are options for fertility preservation with caution, of course, under the guidance of a gynae oncologist.
Yeah.
And then possibly you could have children after that. But more often than not, women tend to present at a higher stage of disease and they present with these high grade serous carcinomas where unfortunately fertility preservation is not an option. One thing that some women can do if they're diagnosed with an ovarian cancer where their gynae oncologist has said, look, I need to remove everything and you won't be able to have children afterwards. The question that you need to ask your gynae oncologist is it possible to harvest eggs, bank them, and potentially have a surrogate later on? Because you
Right.
wouldn't be able to carry your own child. Now, not everyone would be a candidate for that, but it is a conversation that you need to have with your physician.
I was actually going to ask you just that. I'm like, is it possible to actually harvest your eggs before going in for that treatment? Speaking of treatments, you've shared what needs to be done, what can be done. But let's talk about, does insurance in the UAE actually cover these treatments? Because that's, of course, the practical look of things.
So I'm actually very proud that we live in the United Arab Emirates, where number one, every therapy that you can imagine for the treatment of cancer is
Yeah.
first approved in the US. Second country in the world is the United Arab Emirates.
Oh,
So
brilliant.
I think we should be lucky to live here because the standard of care for treatment for cancer, unbelievable. We have everything that you could possibly think of. In terms of does insurance cover, again, we should be very happy that we're living in the United Arab Emirates because insurance is governed by a government entity that makes sure that insurances cover everyone that has cancer. The only limiting factor, unfortunately, could be the cost of treatment. And of course,
Right.
not every insurance has the capacity to cover everything because there are
Yeah.
limits on your insurance. So, what I tell every patient when they come to see me in the clinic, I first ask them, I don't ask them if their insurance covers cancer treatment because for sure it does cover cancer treatment. I tell them to go back and look at what is their insurance cover and how much limit that they have. Because unfortunately, now fortunately we have everything. Unfortunately, the therapies that we have can be extremely expensive. Not only in the United Arab Emirates, it's all, the whole globe. It's like that. Any country in the world that you go to,
Yeah.
these therapeutic agents can be very expensive. And ultimately, a physician has to work within the confines of the insurance limit. So that's number one. But
Yeah.
I also tell patients do not be afraid of the insurance limit because should you exceed the insurance limit, again, very proud to be in the UAE because we have a lot of patient support programs that can help cover the remainder of the cost. So
Amazing.
ultimately, I can say proudly that most patients will get treated appropriately here in the UAE.
And that's great. So, like, someone visiting you could actually get connected with all these support groups as well.
Absolutely. Not only patient support programs that can cover the cost of expensive medications,
Yeah.
but also patient support groups that can help them
Yeah.
mentally at the end of the day.
Exactly, which is, of course, very crucial as well. Now, at policybazaar.ae, obviously, we're doing this live session with policybazaar.ae, and here you can actually compare and choose which critical illness insurance plan you'd like, which one suits you. So, yeah, why don't you check it out as well? Not you, doctor, that was for the viewers.
But if I could add one more comment over
Yeah,
here,
of
simply
course.
because we're streaming live and for people to listen to it. I
Yeah.
think that one shouldn't be laid back about insurance policies. I think everyone should make sure that they
Yeah.
are insured ultimately, because I have patients that come to see me, and this is just from my experience in the clinic. They come to see me, they don't have insurances. They get
Mm.
diagnosed with cancer, and they said, okay, now we'll take out a policy. That it doesn't work like that. You
No.
have to get an insurance policy to cover any eventuality. If you have
Right.
a pre-existing condition, it's not going to cover you. So if you don't have an insurance policy covered, please go and get one to
Yes.
help yourself ultimately.
Very subtly, I'm just going to add policybazaar.ae, guys. We've already spoken about all the options that you can choose from. Okay, there's so many more questions. Let's get to the next one. Are there chances of ovarian cancer to recur after the treatment?
So it's not only ovarian cancer. If you've ever been diagnosed with any cancer
Yeah.
and you've been treated with curative intent,
Yeah.
that does not mean that there's no risk that the cancer can't occur later on.
Yeah.
That's why once you have been treated, your oncologist will put you on a follow up program so that any recurrences can be caught early enough. So, unfortunately, yes, there's always that risk, but with the proper therapeutic plan that you have right at the very beginning, that reduces your risk considerably, but it never goes to zero.
Okay. And compared to other cancers, what are the recovery chances when we speak of ovarian cancer?
So, again, not an easy question to answer because, like I said at the beginning, ovarian cancer is not one disease. It's a plethora of different diseases. And that's why we understand how to treat patients individually. And each individual type of ovarian cancer has its own recovery, has its own recurrence risks. And I can't tell you the baseline recurrence risk, but I can tell you
Yeah.
that the earlier you present, the earlier your stage of disease, the lower the risk of recurrence. So that's
Right.
number one. The higher your stage of disease, the higher your risk of recurrence. Number two, make sure that your physician has understood the biological makeup of that tumor, because if they've understood the biological makeup of that tumor, you have appropriate targeted therapy
Yeah.
that further reduces the risk of recurrence of disease. So, not all cancers are the same.
Yeah.
Not all ovarian cancers are the same. And the risk of recurrences really depend stage of the disease and how you've been treated right at the very beginning, and understanding the biological makeup of that particular tumor.
There's one more question that's coming for you. What are the goals of treatment, cure, control, or symptom relief?
I love that question because
Yeah.
each of those 3 points are very, very different. So, if a patient presents to me in an early stage fashion, stage one, stage two, stage three,
Yeah.
the goal of treatment at that point is cure. Ultimately, it's cure. But when you're trying to cure, you're also trying to remove symptoms because you're presenting with symptoms, right? So you're trying to relieve those symptoms. But the primary goal is cure. In terms of control of disease, that is for patients who have more advanced cancers, where you know you can't clear anything up. You're just trying to control and prolong life. And those
Yeah.
are mainly for patients with stage 4 disease. But I have to say, again, not all stage 4 diseases do the same. And just to give you an example, and that's why I'm going to harp on the fact that understand the biological makeup of your disease. 10 years ago, I had a lady who came to my clinic. Actually, she presented to the hospital in a very acute fashion, was found to have ovarian cancer. She was operated on. She then came to my clinic. I scanned her. She had
Yeah.
multiple liver metastases. That means the cancer had gone from the ovary to the liver. That's a stage 4 disease. My discussion with her at that point, that this is stage 4 disease, the goal is to control. I don't know if I can cure you, but more, it's mainly for control. I
Right.
sent her tissue for biological testing. That means testing the biological makeup of the tumor. I gave her chemotherapy. I gave her targeted therapy. 10 years today, she's still in remission. So I have potentially cured her. But that is
Yeah.
one type of stage 4 disease. It's not all stage 4 disease. And the
Right.
last point that you said is palliative. So you said control, you said cure, control, and you said symptom control.
Symptom relief. Yeah.
Control is akin to palliation, meaning the patient is so far advanced that you simply cannot do anything to help either reduce the burden of disease or give more time. At that point, the only thing that you can do is work with your supportive care team, and an oncologist always works with a supportive care team to make the remainder of life for that particular patient have a good quality of life and as symptom free as possible. So you can see these are three very different symptoms, three
Absolutely.
very different goals.
Yeah.
And that's these are types of the patient that come to you in the clinic. And I absolutely appreciate the person that's actually asked that question.
Yeah, very smart question. And also kudos to you, doctor. And I think all the doctors really, it's is really incredible. I mean, I know we all talk about the fact that doctors are amazing and you do what you do. But especially when you share stories like this, because I would just imagine this lady thinking she has stage four, having stage four, and then probably thinking that, well, this is probably the end of the road. And then 10 years later, it was such a nice story. Thank you for sharing that with us. Okay, next question. Compared to other cancers, okay, we did this one. What are the recovery chances? Yeah, does the UAE have a facility or have facilities to treat ovarian cancer?
Oh, 100%. If we have all the therapeutic agents, we obviously have the facilities to be able to treat not only ovarian cancers, but all malignancies. We have a number of comprehensive cancer centers within the United Arab Emirates, both in Dubai, sorry, not oh, it's in Dubai, Al Ain, Abu Dhabi, Sharjah. You've got big cancer centers there. Mediclinic is one of the cancer centers. We have a comprehensive cancer center here, but we've equally got a number of other comprehensive cancer centers that can provide you with appropriate multidisciplinary therapies.
Yeah, and now you've seen the lady who's going to be doing it as well. You can always get in touch with Dr. Shahina from Mediclinic. And how can I manage treatment related side effects? Is the next question in for you.
Again, very, very important. And I'll go back to my holistic approach that I say. First of all, when you're going through therapy, if anyone out there is going through therapy, 90% of dealing with the side effects is up here. It's being mentally strong. I always say if you're mentally strong, you will breeze through it. Number two, exercise, 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 exercise. Please do a minimum of 30 minutes of walking every day. I had a patient who walked into my clinic the other day and said, I can't exercise. I don't like to exercise. I said, go to the mall, walk and
Just
shop
walk.
if you have to,
Yes.
and exercise because that's what's going to get you through. I have a patient right now, I kid you not. She did kickboxing and learned taekwondo during chemotherapy. She looked fitter than all the other doctors in the unit. And
Wow.
that's how she got through the chemotherapy. So please exercise. It will make the symptoms a lot less and it'll allow you to have as normal a life as possible. Yoga is very good. Acupuncture, we have scientific proof that acupuncture reduces the symptoms by almost 50%. So, this is what I would advise. And then ultimately, the last bit is the physician. Sit with your physician, sit with your medical oncologist, and go through all those side effects that you are potentially having. Because ultimately, when I sit with my patient in my first session and I talk about the chemo journey and I talk about the potential side effects, I'll give them a plan of how to handle the side effect, but I'm giving them a blanket plan. I'm
Yeah.
telling them what could and could not happen. But each person is a human being. So you come in with your individual side effects, and we sit down together and we discuss how to handle them and what drugs I need to give, what drugs I should withdraw, and how
Yeah.
to get you through that journey. So I think if you put that all together, the journey will not be difficult.
I think that was a great suggestion, especially in the UAE heat. Just get to the mall, guys. Do some window shopping. Window
Absolutely.
being the keyword. Yes. Okay,
I
next
actually,
question.
I'm apologizing that I'm interrupting you. I had a patient walk through my clinic yesterday.
Yeah.
You will not believe it. She didn't have a clinic appointment. She just came to my clinic just to inform me that she had a credit card that she needed to pay up simply because she did so much shopping during her chemo that she was broke. But she got through her chemotherapy.
A win is a win. So we're going to appreciate what she did. Yes. Okay, next question in for you, Doc. Do stem cells help in conceiving post recovery?
I think stem cells is a very interesting field. I think
Yeah.
there's a lot of clinical trials out there that are looking at stem cells in terms of both therapy for cancer that could potentially, maybe 20, 30 years down the line, even cure cancer. We don't know that. It's something that's still being studied. Specifically, you're asking the question about whether they can conceive with stem cells. The simple answer is no.
Okay.
There isn't any data out there, maybe
Okay.
in the future, but right now there's unfortunately no role for that.
I'm glad we have you on this live session because I'm reading the question again. And it's just like, wait, I don't understand the question, but hey. All right. We're going to go into a round of myth busting with Dr. Shahina right now. I'm going to say a statement and tell me if it's a fact or a myth. Okay?
Okay,
Ovarian cancer always causes noticeable symptoms.
myth,
Myth. Okay. Only older women need to worry about ovarian cancer.
myth.
Also, again, like what is the definition of older women?
So when I think about older women, I think about women who are 60 and above.
Okay.
Um, and if you come to my clinic, I have currently 5 patients with ovarian cancer who are below the age of 40. So again, it can happen at any age. Yes, as you grow older, your risk of getting ovarian cancer increases. So it
Right.
doesn't only happen in older women.
Yeah. Okay, so that's a myth as well. Next one, birth control pills can increase the risk of ovarian cancer.
Fact.
This one's a fact.
But
So
it's a
birth
very
control.
slight risk. It's only a very
Okay.
slight risk. It's not a high risk.
Okay. If no one in my family has had cancer, I'm not at a risk.
Myth.
All right. And can it reoccur?
Pardon?
Can it reoccur?
Fact.
Fact. Well, I think honestly, this has been a great, insightful chat for me because I had no idea of so much that you shared. So thank you, Dr. Shaheenah Dawood.
Thank
Once
you.
again, she's from Mediclinic, guys, a leading oncologist here in the UAE. And thank you for sharing your knowledge, helping us break the silence and just raise awareness about ovarian cancer.
First of all, thank you for inviting me on this platform. I have to admit, I didn't know what Policy Bazaar was until I came on this platform. So thank you for educating me about that. So that's number one. Number two, I find that all these platforms, the fundamental goal, at least for me, and today we're talking about ovarian cancer, is to empower women, engage with women,
Yeah,
and educate women about ovarian cancer. But the
yeah,
empower education and engagement is not only for women, it's for everyone. Everyone should get their health checkup. Everyone should support each other, and family members should come together and work together to beat this disease.
yeah.
So I feel that these three words should be echoed to everyone.
I agree. I agree because it's no longer a men's issue or a woman's issue. You know,
Absolutely.
yeah, it's everyone should know, which is why we're doing this to raise awareness and to our viewers. Awareness is, of course, your first line of defense. Your regular checkups. Now, hey, I'm not a doctor, but here's all that I've learned from this wonderful
Let me
lady.
test you now. What have you learned?
So yeah, regular checkups to check your family history, to know your family history for sure. So go ahead, be that little stalker in your family groups, do some digging around, know your family history, and most importantly, I think the biggest takeaway is to have the right insurance.
Absolutely, absolutely. And I give you an A star for that, Bhairavi. Thank you for listening to what I was
Yeah,
saying.
thank you, everybody. And you too can visit policybazaar.ae to explore insurance options that include coverage for critical illnesses like ovarian cancer. Stay informed, stay empowered, and remember to get the right protection with policybazaar.ae. See you next time. And once again, doctor, thank you so much. I know you're extremely busy. So we're going to
Thank you
let you
very much.
get back to your patients now and talk to you soon.
Bye.
Bye.
Thank you.